How long do you think this 62-year-old lady had this pink patch slowly growing on her abdomen? Go on, guess. It's 10 years. She'd seen a couple of doctors over the years who prescribed emollients and steroid creams, but with little effect. There are no other patches on her body, it isn't itchy, it isn't painful, and there's no history of psoriasis in her or her family, and no other skin conditions. What is it, and what would you do? It's an irregular pink plaque, around 40mm in diameter, dry and scaly to touch. Could it be one of our scaly 6, or something rare like a cutaneous lymphoma perhaps? Did the dermoscopy help? Well, for me it was yes and no. There was nothing seborrheic keratosis about it, with no fissures or ridges pattern or milia present. It could be a wart, but I'd never seen a wart such as this on an abdomen before. It wasn't like a keratoacanthoma, so I ruled that one out. Initially I thought Bowen's, but there wasn't the obvious coiled and knotted vessels throughout, although perhaps the odd suggestion here. There were no rosettes of actinic keratosis, but the background was a diffuse pink, with a lot of adherent scale all over it. There was little to suggest a squamous cell cancer, fortunately, and with its long history, I thought this was unlikely. Was this something rare I'd never seen before? I was at that point where I wasn't sure. What were my options? I felt a histological diagnosis was important, so if you didn't have the surgical skills, a referral routinely would have been appropriate. What about cryotherapy? This is rather large for that, and you're also being quite brave with no histology. After a discussion with her, we opted for a small incisional biopsy, taking some of the lesion and normal skin, so the histopathologist has a transition. With the lesion being similar all over, I felt this was reasonable. I could have excised all of it, but the scar would have been rather large. And here is the histology. It was Bowen's. It just go to show you, evenly spaced and coiled vessels aren't always present in Bowen's disease. So what now? I went for imiquimod, and I opted for 5 nights a week for 5 weeks. Here's a photograph after 17 treatments that she sent me. She tolerated the treatment well, and I reviewed her 2 weeks after the treatment ended. The redness will fade with time, and she was delighted that her skin was smooth and flat once again. I always quote a 5 to 10% recurrence rate, but if this happens, at least next time we have a good diagnosis.